Greetings, everyone. Welcome to this LinkedIn Live on technology transformation of care management solutions. For those of you who already joined us, thank you for joining on time. We'll give everyone maybe a minute or two before we start. In the meantime, do tell us where you're dialing in from. Uh, the hosts today are dialing in from Gurgaon and Bangalore, and we would like to also know where you are all are dialing in from. While we wait for people to join in, I thought maybe it's a good idea, Priya, if you can share your perspectives on hymns. You and I were both there, so would be interested in knowing what were your key takeaways from hymns.
Sure, Chunky, and I guess that particular question never goes out of league. I guess there were two dominant themes for hymns this year, and no brownie points for guessing, but it was, I'll say, artificial intelligence and cybersecurity. We want to start with some good news, so we'll start with probably generative AI. Lot more conviction this time when we were hearing about the solutions from the entire ecosystem. Even from the enterprise side, there was a lot more interest in knowing what is really that can be implemented, if there is ROI, if there is cost benefits that it's bringing to the table. Ultimately, I'll say how it's really impacting the value chain across claims, administrative related things, and actual outcomes was the focal point of almost all discussions that we were having. Cybersecurity, not just because how the healthcare industry has been in the last few months, but I guess we are definitely at a point where at some point we definitely needed to have those conversations about cybersecurity. And now, because of some of the unfortunate events, while there has been the nudge, overall there is a more positive sentiment in which the CIOs actually want to understand what investments need to be made in this area, and there seems to be more interest from the enterprise side to build out that plan around cybersecurity. So while there were a lot of other themes around, say, around care management, remote patient monitoring, technology adoption, I'll say these were the two dominant themes that kind of emerged at HIMSS this year.
Yeah, I would agree, and I think particularly on Gen AI, a lot of interest from payers and providers on how to scale some of the use cases that they want to take to production. So yeah, all in all, I think good conference. So I think we're a couple of minutes in, so we should begin. So welcome again, everyone, to this LinkedIn Live on technology transformation in care management. Uh, I'll be your host. So I'm Chunky Satija, Vice President with Everest Group, and a part of our healthcare and life sciences team. And today I'm joined by two of our healthcare leaders and subject matter experts in care management. So I have Priya and Kaushik. Priya, do you want to introduce yourself?
Thanks, Chunky. So my name is Priya Sahani. I'm a practice director with the firm focused on the healthcare practice from a technology standpoint. And one of the areas where I'm very focused on is care management and how it's impacting the healthcare world from a technology standpoint. Kaushik?
Hey, thanks, Priya. Hi, everyone. I'm Kaushik from the Work as a Practice Director. I dive to part of the healthcare technology practice. Again, like Priya mentioned, we closely track product services from a care management, patient engagements, and some of the other payer areas as well. So glad to be part of the call.
Thanks, Priya and Kaushik, for being a part of this LinkedIn Live. So Priya and I are dialing in from Gurgaon. Kaushik is dialing in from Bangalore. Again, for those of you in the audience, let us know where you're dialing in from. So this is the coming back to the LinkedIn Live, the topic of the LinkedIn Live, right? So this is the second LinkedIn Live in the series of LinkedIn Lives that we are doing on care management. In the first one, we talked about what is a care management platform, what are the different modules, and from a payer and provider perspective, what are the investment areas and how are they different from one another, right? But for today's LinkedIn Live, we'll take a slightly different approach. And the reason for that is in the past 6 months, all three of us have had a lot of conversations with payers, providers, and the supply community on care management. And what all three of us have done is identified some of the top discussion areas or top topics that came up in those discussions, which could be where we had a lot of interesting discussions, or which could be where we got a lot of questions. So what all three of us have done is we've come up with our list of what were those top topics. And what I've done for this LinkedIn Live is selected the top five. And what we're going to do is spend some time on each of those five, talk about what is it that we're hearing, what is our perspective, and we'll also be interested in hearing perspective that people in the audience have or questions that they have. So that's what we're going to do today, right? So, and to kick us off, the first topic that I think was number one in all three of our list was prior authorization. So clearly, this is an area where we've had a lot of questions as well as a lot of good interactions. Uh, so maybe Kaushik, I'll pose a question to you, right? So I mentioned that we're getting a lot of questions on prior authorization. Can you talk us through what are the kind of questions that people share in these interactions?
Yep, sure, Sanki. So again, if and like you mentioned, right, I think prior authorization is one of the areas where we see a lot of uptake, right, both in terms of demand and also supply. And I think the questions that we hear are also from both the ecosystems, right? So from a demand standpoint, the questions that we generally face are around how do we even streamline prior authorization, right? Given there are a lot of steps involved with regard to intaking some of the claims, processing it, responding to some of the claims. So what are some of the processes which need to be streamlined given a lot of the claims are also manually driven? So from an enterprise standpoint, one of the things is how do they streamline it? And two is even if they have identified the processes, what are the guardrails that they need to adhere to, right? So one of the key things is also by when should payers kind of respond to some of these provider requests, right? So I think these are some of the, I'd say, questions slash challenges that we hear from enterprises. And I think the question from the supply ecosystem is, given there are a lot of these processes involved, how do they go about developing these capabilities, right? Are they wanting to streamline all the touch points in the prior authorization process, or is it going to be a best of breed approach, right, wherein they pick out areas where they want to streamline it, and some of them could be manual driven? So I think these are few of the questions that we have received over the last 6 to 12 months on prior authorization. And I think one of the things that CMS have done recently would probably solve for some of the questions or challenges that we discussed, right? So recently CMS had mandated this rule around creating a prior authorization API. Right. So while I do not want to go into the details of it, but some of the key takeaways that I may want to leave the audience with are, it ideally streamlines three of the major pain points that suppliers and enterprises have. One is payers will have to make available the information around the services and the clinical operations that need to be prior authorized so that providers can have access to that list before even raising the request. That is one. Two is how does it even get electronically transmitted, right? So they would be putting up an API upon which providers can share the prior authorization request. That is the second aspect of it. And the third aspect is more around response, right? So when I say response, it is not just providing a yes or a no. The more important aspect is also providing a reason code for a denial, right? And that is one of the important aspects when it comes to prior authorization. So given these are some of the processes that need to be streamlined and all of them are planning to get, I would say, digitized through these API, I think this would probably solve for most of the issues that enterprises and even solution providers are looking at.
Thanks for that, Kaushik. Right. So I think you mentioned the word streamlined a few times, right? So it's clear that there's a need to streamline the prior authorization process. Priya, can you talk us through how this lack of streamlining or let's say the inefficiencies which are present in the current process, how do they impact care delivery?
Yeah, sure, Chunky. And you have raised a very important point around the inefficiencies. So what we are hearing a lot is that this is not something new, but a lot of the times the care is actually delayed because the prior authorizations are not done on time. And there have been a lot of instances, in fact, according to some of the research and surveys that have been done over the last few years, in more than 80% of the cases, the actual care is delayed by some time because the prior authorization is not done in time. And in fact, there is also an evidence to prove that in at least 30 to 40% of these cases, what really happens is that it leads to more emergency visits, which is not just an unpleasant experience for the actual patient, but it also increases the overall cost for healthcare as an ecosystem, including everyone, your peers, providers, and the final patient. What all of this means is that, while we are focusing a lot on the other crucial aspects of care, which is around your actual care delivery or your treatment plans or your coordination, the part around utilizing care or prior authorization becomes a very important part, which is kind of delaying the care at the other practices. And I guess that's probably why, we are also hearing a lot more focus happen on this area. I'll also, kind of build on what Kaushik mentioned. So the government's mandate around making sure that there is an API coming into the picture by say 2027, or in fact the things such as for non-complicated areas, you would still have to revert within 3 days. You cannot really delay it more than that, and you would also have to give a more proper reasoning so that it becomes more convenient for the providers. What all of it is ultimately meaning is that there is definitely a need for more streamlined prior authorization solutions, which is something presently the processes cannot do, maybe till the time there is more digitization adoption or more adoption of these some of the technology solutions that can mention the challenges that both of you laid out.
Thanks, Priya. So you mentioned that there are a lot of delays and the fact that there's not a lot of digitization, right? So it's quite clear that, again, due to the low technology adoption, that's a big contributor to the inefficiencies that we see as of today, right? So where do you see technology playing a big role in the entire prior authorization process? Where can it have a big role?
Yeah, and that's again a very interesting question. So I'll probably start with, if I think about the prior authorization value chain as a whole, there are multiple aspects to it. The receiving of the documents from your healthcare providers, the actual and the most critical part in some ways, which is around the actual review of the prior auth documents, till the point around communication. I guess review is the part where something like AI or ML is something which is making maximum impact, and it is something that can really reduce the timelines that we have today for prior authorization and solve for some of the challenges that we talked about. So review is a part on the probably the value chain where we are seeing a lot of technology solutions come in, AI ML getting used, in which you are able to actually look through those documents in a more digitized format, and actually figure out if there are inefficiencies or if it's decline, what's really the reason behind it. I guess the other crucial metric here is that while review, we all agree and we all can say that it is definitely one of the most important parts, it's also something where there are sufficient investments happening. But what is also kind of inhibiting the industry is that we don't have a more end to end view when we are looking at the entire value chain, which is where the intake and communication part really comes into the picture. So, in a lot of the cases, the providers are still submitting those documents in maybe a fax kind of a format over an email or over a phone. And even when there's a communication going back from the payers to the providers, it is not completely in a digitized format or in a seamless format. And hence, since there are three different parts of the value chain which are not tied to each other, the overall process still reduces down. For instance, if you're communicating to a provider that a claim has that a prior authorization request has actually been declined over a cell phone, it's actually again leading to more inefficiencies into the ecosystem. So I guess what would help the ecosystem entirely is if we have those end-to-end solutions which can tie all three parts of the value chain together. We're definitely seeing some of it happen, but definitely the adoption seems to be inhibited in the front, which is the intake, and the end, that is the communication part of things. But I'll probably mention one more thing here is that for given some of the reasons that we just spoke about, technology adoption in this particular area, while as of now we say that it's not maybe anything more than say 20-21% from an overall standpoint, it is expected to it's expected to increase a lot over the next few years, given the regulations and the requirements that are being posed.
Completely agree, right? And I would even say that this is one of the areas where we are seeing more, I would say, faster transformation compared to some of the other areas. So I think, like, at least based on my conversations, I definitely expect, I think this is one area where we'll see more development in terms of more end-to-end solutions and how enterprises adopt it. So let's move to the second topic. So the second topic that I want us to talk about is home-based healthcare. And I think out of all of the five, this is where I sense the most confusion when I'm having conversations. So Kaushik, I don't know if it's the same for you, but if it is, can you talk us through what is creating this confusion?
Yeah, sure, Chunky. And I completely agree. Right? I think the confusion is extremely higher in home-based healthcare in comparison to some of the other areas on the care management side. And maybe before even moving on to what are the things that are really complicating the definitions across the home-based healthcare ecosystem, I think home-based healthcare as a theme has significantly picked up, right? And that has also probably led to the reasons for multiple terms kind of emerging here. Especially, I think since the pandemic, the kind of investments happening from both the demand and supply has significantly picked up, and given that the supply ecosystem is evolving, each of them kind of take a different offering to the market, and they kind of coin their own terminology for it, right? So, to kind of keep it standardized, the way we look at it from a home-based healthcare ecosystem is three major things, right? One is how does it get provided in a traditional format at a patient's home. This could be clinicians or caretakers visiting a person's home to provide care delivery, right? And this, I would probably call it as a traditional home-based care delivery model, right? Wherein there is not a lot of technology interventions involved, but this is probably the most primitive format of home-based healthcare. And I would probably say this was before pandemic. This was probably more of a highly adopted model. Over the last few years, I think it has kind of evolved from being a traditional at-home model to more of having remote applications or solutions, right? So this, we can probably coin it as virtual care or telehealth, right? Wherein a tele health application or a mobile application is being leveraged to connect providers and patients remotely, right? So the convenience is that the patients would not need to visit hospitals, and the providers would not need to visit the patient's home as well. And this is probably the, I would say, phase two in terms of home-based healthcare delivery, and the most evolved stage. And probably since the pandemic, this is probably the area where we see the maximum investments is on the last stage, which is remote patient monitoring, right? And I would say this is far more advanced because this goes even beyond just care delivery. Even for people who have been treated but would have to stay at home for getting care from a recovery standpoint, this is extremely helpful, right? And the benefits are, one is patients who are probably Medicare patients or people who are with severe illnesses who are not able to travel to hospitals can get care remotely. And even from a provider standpoint, right, they are able to better identify some of the care interventions, identify or rather track vitals of patients in real time, and also provide interventions, right? So in terms of ease of access to care and ease of care delivery as well, I think RPM is probably one of the most advanced ways to resolve some of the serious issues. So this is how we kind of define the market, and we do see a supply ecosystem catering, providing services across all three segments.
Thanks for sharing that, Kaushik. And I think the three areas that you described, and I think that sum up what at least we think of when with what we mean when we say home-based healthcare, right? And I think going back to the confusion, right? And I think this is something that became apparent, particularly after the recent news that we saw from Optum and then from Walmart, right? And the kind of questions that we were getting out after that was, does this mean that home-based healthcare is on the decline, right? So, Priya, interested in your thoughts, right? Particularly given a couple of these, I think, big news that we have seen in the recent past. Do you think that home-based healthcare is on the decline?
Yeah, and that's a very relevant and interesting question because we keep hearing very different views on this particular topic, where there's definitely a stream believing it's on the decline and a different pool of people believing it's actually the adoption is rising a lot. I guess the way we would like to put it is that the pandemic really gave a push to telehealth, or the virtual exchange of caregiving, and which is what Kaushik also touched upon. What we've seen is that as it was predicted after the pandemic, there is definitely reasons for the telehealth thing to go back, where people are actually preferring to visit hospitals and not go for a lot of those virtual calls. But the actual essence of home-based healthcare or is not really in the virtual conferencing side of things, but it's actually in the remote patient monitoring side of things, wherein you can bring the entire experience at home. And I guess this is where the industry is also heading towards. While particularly the way we are defining the home-based healthcare ecosystem, something like telehealth is not something which might say that is increasing at a drastic growth rate, given some of the, as we've seen in the recent past, some of the supply side audience has actually decided to not focus as much on that area. But if you think about the broader pool, which is around remote patient monitoring, that's definitely on the rise and receiving a lot of importance. And I guess some of the reasons are also around that we are seeing a lot more potential where something like a remote patient monitoring tool, when it's brought into the ambience of a home, can really improve the health outcomes of the patient, which is not something your traditional virtual care or traditional telehealth services could do. And now, since there is more appetite to actually improve the care outcomes, be it by round the clock monitoring or more prediction of any kind of adversity happening to a particular patient, or even in cases where we've seen that post acute care delivery, if a patient is monitored 24/7 over the course of the next few months or years or whatever is required, the outcomes that can be delivered really improve. And hence, the entire ecosystem of remote patient monitoring is witnessing a lot more adoption and is increasing. While I would agree with what you mentioned, Chunky, that traditional telehealth services, they might not be as much as on a rise as we saw during the era of COVID-19.
Yeah, and I think the way I look at it is, again, right, we had telehealth, I think largely as a necessity because of the pandemic, right? But it was, like, I wouldn't say across the entire industry, but for a lot of them, the focus was just on making sure that healthcare practitioner and patients are able to interact with each other, right? But I think as we move forward, a lot of the three areas that Kaushik you mentioned, right? I think a lot of them will become integrated, right? You don't need a separate telehealth solution. A lot of it will be integrated in how care gets delivered at home, as well as, again, with some interventions with remote patient monitoring or devices for remote patient monitoring. So I would also agree, right? I think in my view, I don't think some of the recent news signals that home-based healthcare is on the decline. It's, I think, just the way it gets delivered, some of those models, I think they would continue to evolve. So, Kaushik, a question to you, right? If you think about home-based healthcare and if you think about all of the different specialities where it is currently being used, is there a difference between how it is adopted in one specialty versus other, or do you largely see similar adoption trends across all?
No, I think, Chunky, I think that's a great question, right? Because we spoke about adoption of home-based healthcare, and again, it is evolving, right? Like you mentioned, it was from a traditional home-based care model to virtual care to RPM. So certainly, I think adoption is different, and depending upon the type of care being administered and the specialty being provided, it is different, right? So again, to throw more color, if we were to look at broadly categorize some of the care management issues, one could be primary care. This could be more around visiting hospital for a minor issue, which would probably need a 30 minutes consultation. This is where probably home-based healthcare is significantly used because there is. I think this would save up patients' time, right? Given these are also smaller conditions to kind of look at. I think primary care is probably one of the areas where we see higher home-based healthcare intervention. And the second one is chronic care, right? And this is where I'll touch upon specialties. If we look at chronic care, we're ideally looking at conditions which are pretty severe and which would need treatment for a longer span, be it 5 or 10 more years. So, in terms of specialties, I think cardiology is one of the areas where we see significant adoption, followed by the likes of diabetes and pulmonology, right? And some of the IOMT devices prominently used are ECG monitors in terms of cardiology to kind of track those vitals. Same for pulmonology, it is around the vitals tracking devices. It could be glucose monitors, it could be your oxygen levels to track, right? So we do see devices getting deployed, right, more frequently. And yeah, I think in terms of specialties, I would say cardiology, followed by pulmonology and diabetes are some of the prominently adopted ones. Okay.
Thanks, Kaushik. So I think let's move to the third topic. And before we go there, just one thing that I would like to mention for the audience is if you have a particular question or if you have some perspective, please do share that with us, right? We would love to hear your perspectives and also love to hear your questions as well. So with that, let me talk about the third topic for today, which is social determinants of health. And across all of my conversations with payers and providers, not just in the last 6 months, but even before uh, this is one area which is continuously cited as one of the top investment priorities or one of the top priorities. Uh, but I think the question that I always have is after these interactions and hearing that this is a top priority after so many years is does the investment in this area proportional to the amount of interest uh, that I've seen in those conversations, right? So Priya, would be interested in your perspectives on what you see here.
Yeah, and probably Chunky, I like to break it down into two areas. One is that the kind of lip service that is done in this area, does it really even merit that kind of an investment? And secondly, to your actual question, do we actually see proportionate investments happening? So probably I'll say the harsh truth is that no, we are still seeing a lot more conversation around it, a lot more emphasis on the fact that the usage of social determinants of health across the care spectrum can actually yield the kind of results which would help you improve the outcomes a lot. But generally, we've not seen enough number of solutions or even the payers and providers investing in enough to bring in that social determinants of health flavor. But I'll not say that this is something which is completely theoretical and has not happened. So I'll take up example of one of the large health systems in the Midwest side of the area, wherein they have actually adopted social determinants of health to look at the actual patients who are at risk. And what they noticed was that they were actually able to see at least 50% more people at risk than their earlier models could have helped them design. And because of this, the overall analysis proved that they were able to predict people who are at risk and improve their overall health outcomes a lot over the next few years. So there are different ways to see in which particular areas. In this particular case, there was actually a huge difference in between the actual lifespan of these people when the social determinants of health aspect was ruled in. So I guess the point that I'm trying to make in here is that while today, as of now, the population health management, risk prediction, or risk stratification tools that we see, very few of them are actually putting in aspects of social determinants. There is definitely a huge merit if we are looking at this area and we are leveraging it for our daily services that we are providing around care management to the patients.
So, Priya, your answer, and I think what I mentioned at the start, right, about interest versus investment, I think also reminded me of the fourth topic that we have, right? And it's very similar to that, which is value-based care, right? Again, and we can probably spend a whole LinkedIn live on just value-based care alone. So, Kaushik, maybe just some quick perspectives on why this is an interesting topic and what kind of questions or discussions are we having with this?
Yep, sure, Sanki. And I completely agree, right? This is very relevant to what Priya mentioned around SDOH because, again, like your remote care and patient engagement, the dialogue around value-based care has been going on for a long time, right? And the term value-based care itself is a huge term which cuts across multiple areas, right? There are aspects around the care management side of things. One is around population health management, right? So how do we better leverage some of the data beyond just clinical and claims data, right? And I think the data point that Priya mentioned around SDOH data is a significant input for kind of streamlining population health management. So I think this also addresses the broader issue that we see in the healthcare, which is social health equity, right? So by identifying data sets that go beyond clinical and claims data, how do we better identify a set of or a strata of population by way of demographics or by way of income or could be any other factor which goes beyond clinical and claims data, right? So how do we identify those set of population and proactively provide interventions? So I think social health equity is getting addressed and the broader umbrella is population health management, right? So we do see from a supply ecosystem standpoint solutions developed just to cater to population health management. I think that is one of the areas where we see investments. The other area where we see not so much from a care management standpoint, but around the contracting side of things, right? Because the entire construct around value-based care is how do reimbursements happen based on the quality of care and not so much on the quantity of care, right? So while there is an emphasis on the quality of care, how does it get implemented across payers and providers, right? So again, from a contracting standpoint, we do see solutions being implemented so that payers and providers are better able to forge these contracts and also have some KPIs to kind of track some of these initiatives and make sure that payments are made more seamlessly. I would say these are the two areas, Tanki, within value-based care where we see more adoption. Of late, we do see some solutions which cut across multiple categories, and they take more of an end-to-end value-based care solution story, right? So while the adoption is lower here, we do see few solutions which cater to population health management, contracting, and the other areas of value-based care, which could involve utilization management, prior auth, and so on and so forth. So we do see dialogue and investments happen, but in terms of end-to-end value-based care solution, it is still nascent with regard to adoption.
Thanks, Kaushik. And I think while you were answering that question, right, we have a few viewers. So we have Rita dialing in from Brooklyn, we have Lacey from Philadelphia, we have David from London, and Katrina from Boston. So hi all of you, and thank you for joining in. Uh, so we've covered 4 out of the 5 topics that we wanted to do, right? And before we go to the 5th one, I also wanted to talk about some of the research that we are doing in this space. So last year we published a Trailblazer report on care management platforms, and for those of you who are joined this call, we are as a complimentary offer, you can download a complimentary abstract for that particular report and get in touch with us. Uh, there's also one peak matrix assessment, Priya, that you are currently about to wrap up, and I think you expect that to publish in first half of June. We want to talk about what that peak matrix is, what are you doing in that assessment, and how you're doing that.
Sure, Chunky. So, the objective of running this peak metric assessment around care management is to look at the key leading players who are evolving in this area. And when we are looking at this, we are actually looking at it from the end-to-end value chain, where we are looking at the utilization management or prior authorization side of things, along with case management, how the care delivery is actually done in terms of your treatment plans, disease prediction, population health management, and also your solutions around wellness management. So this is again a very high level view, not meant to be an exhaustive one, but we want to look at all solutions that we see emerging in this space. We are taking the inputs in the forms of briefings, buyer references, as well as RFIs, and we are looking at that information to look at the most relevant players that we see in this ecosystem who are providing technology or platforms, either in terms of, say, addressing one part of the value chain or coming up with more end-to-end solutions that can actually provide or that can actually make a difference in the care management ecosystem. I guess this particular report, as you mentioned, is going to be out somewhere in June. We are almost at the final stages of receiving all the information and publishing this report. Some of the things that have emerged out of this report, which are more interesting, is some of the things that we actually kind of touched upon: prior authorization as well as remote patient monitoring. Apart from this, some of the other areas where, from an investment standpoint, we see maximum differences being made. First is definitely population health management, where earlier, while the solutions were just focused on, say, areas around, say, risk stratification or patient risk identification, now there are lot more holistic solutions which are also addressing things around virtual care within the same modules, and looking at more integrated data sets that can actually solve patients, that can actually predict risk to a higher extent. Some of the other areas where generally we have, say, till last few years we had not seen as much investment, such as mental and behavioral health, etc., are also things where there is lots more integration happening as of now. These are some of the interesting things that we have seen come out as a part of this particular peak matrix assessment.
Thanks, Priya. And once again, I would remind people that this report is expected to be out first half of June. So keep an eye out on that. And if you have any questions, do feel free to reach out to Priya. So I think this brings us to the last topic, right? And I don't think there are no prizes for guessing what the last topic would be, right? So that's Gen AI. So I think, Priya, you were also mentioning your reflections from HIMSS, and this was one of the things that you talked about, right? So I think there's clearly a lot of interest. We are also at an interesting time where everyone wants to invest in Gen AI. At the same time, there's also a lot of pilot fatigue that we are hearing from payers and providers. But I think at least throughout all of my conversations, I think payers and providers are definitely looking at as a technology uh, that can really help them not just improve efficiency but also change the ways they work in certain areas, right? And I think while we've seen, I would say, a lot more investment in areas such as contact centers and RCM, the question for both of you is, can we expect similar sort of investments in care management as well?
Yeah. No, I think that's a loaded question, right, Chunky? So in terms of investments in generative AI, like you mentioned, payers and providers are both wanting to invest in it, and customer experience seems to be one of the low hanging fruits for them to kind of address. It is also because of a few factors, right? One could be the ease of implementation with regard to how quickly they can take that offering to the market, and that is also basis the data points that they need to leverage, right? So I think in terms of implementation and the impact it can generate easily with some of the members or patients, customer experience is one of them. And I think on enhancing the operational side of things, again, within RCM, clinical documentation seems to be one of the prominently adopted use cases. We do see more investments happening, and I think few of them have also moved from pilot, right, and are probably closer to production as well. Certainly for clinical documentation and medical coding, wherein it is intelligently or smartly able to summarize some of the conversations between a provider and the patient, and not just providing a summary but also providing the next steps, action items in a very crisp format, right? So I think generative AI certainly is able to streamline some of the, or rather able to enhance some of the operational efficiencies, right, with regard to customer experience, with regard to clinical documentation, medical coding. If we actually talk about the clinical side of things, again, in terms of impact, I think it would have the maximum impact. But in terms of complexity, I think it is higher, right? Given there are different data sets that need to be leveraged, and basis that is when you can train the models, right? So given we have claims data, clinical data, SDOS data that we were referring to earlier. If there is any laboratory data that needs to be included. So again, given claims as given care management is a huge area, and implementing it would have higher complexity. We do see investments happen in this space, but it is not at a pace at which we see some of the other use cases getting enabled. And the reason is probably right. The complexity is one, the access to data sets could be two. But I think in terms of impact, if it gets implemented and as we see more solutions getting enabled in this space, we would see the maximum impact for providers, right? It will significantly enhance clinical outcomes for patients. Two, given the clinical outcomes are better, it will also save up a lot of cost for providers and also payers, right? So in terms of areas ripe for investments, I would say care management, or rather the core care delivery and care coordination is a huge area for investment in generative AI.
Yeah, and Kaushik, I kind of actually agree with you, and I'll just, mention one something that I heard over the past few months. So around the area of, so I like completely agree that, care management has definitely not been the first area to witness adoption from generative AI, or even to see that kind of an interest that some of the other areas such as clinical documentation or even contact centers and claims management saw. But the interesting part about this particular area is that around some of the areas, for example, image analysis, etc., the impact that something like generative AI has actually been huge, and we've seen a lot more improvement, not just in the efficiency side of things, wherein earlier, if you were able to say do the analysis around say 5 images in a day, now you're able to do it for more than 50. So it's the efficiency part is definitely taken care of, but the second and the more interesting part, which is the ultimate aim of improving the healthcare outcomes, has also actually gotten better. So there were abnormalities that were earlier, which are just not possible for the human eye to detect, which in some of these cases, generative AI has been able to detect. So while that this is an area where this is just one of the examples, we can expect to see more of this happen in the future, where the actual prediction or care treatment plan design is something generative AI could impact. However, I'll use the word very carefully. I'll probably impact and not really take over, because given care management is an area which is, even if generative AI is coming, it's still going to have a very huge human involvement, as well as a lot of cautionary stand, given the risk factor associated is still going to be huge.
Yeah, thanks for sharing those perspectives as well, Priya. Right, and I think even if you look at where some of the non-healthcare or some of the big tech companies have tried to make an impact, a lot of it is around using AI for imaging, right? Even before ChatGPT and Gen AI, right? And I think those are still areas where, while it might take longer to see the kind of impact that we see in some of the other areas that you mentioned, it is definitely an area where the impact would be highest. So I think that brings us to the end of those 5 topics that we talked about. I think there's one question from the audience that I'll ask both of you. So the question is from Katrina, and the question is, what's the degree to which you are seeing patient data coming from personal devices being actively incorporated into the care management platforms used by healthcare providers?
Yeah, and that's, very interesting topic, Katrina. So I'll say this is something, if I think about any care management solution, possibly the most important thing is the data layer that kind of brings in. And data from your personal devices has honestly never been something which has been incorporated into our data management layers or data lakes very actively in the past. However, since everyone recognizes how some of this data can have a huge impact in which how the entire value chain functions, some of the large healthcare payers have started to giving this area a lot more interest. And so what we've seen is that some of these large payers are investigating firstly if they can bring in this data and embed it to the actual data lakes that they have and use it for not just clinical decision making, but also in wide range of other things which are impacting the ultimate care. But beyond some of the large healthcare payers who are trying to investigate it, I'll say the other side of the house, it's still really not been able to leverage it to the extent to which some of this data can actually impact. But I would agree with the fact that your data coming from your remote patient monitoring tools, wearables, as well as all the devices that are used on an active basis is something that can really impact your overall analysis to a very large extent.
Thanks for those perspectives, Priya. And there's also a comment from Rita. What a great point, Priya. Improving health outcomes is the primary KPI. So well done, Priya, for sharing your perspectives. I think this brings us to the end of the topics that we had, right? Priya, Kaushik, any closing comments from either of you?
I think I'll just, echo one of the points that we made around, health outcomes being the primary KPI. So a lot of the investments, let it be from a generative AI perspective, or even generally how technology is shaping the ecosystem, might be on the admin side of things, wherein we are actually improving the efficiency of the things a lot. Be it increasing the rate at which prior authorization is done, or increasing the rate at which you are able to look at your images or scans, etc. But I think ultimately what the industry wants to head towards is leveraging all of this technology to improve the outcomes in terms of better predicting if a specific patient is at risk, or making a diagnosis which is more accurate, or a treatment plan which can work better for a particular patient. While this is still the area with maximum ambiguity and regulatory scrutiny, this is actually also the most important area from a technology adoption standpoint, which will lead us to the actual aim towards better health outcomes.
Yeah, and as with any new technology, right, the use cases that we see at the first are usually the low hanging fruits, right? And as Priya, you mentioned, right, the I think the ones which will have the more impact, but are also the most difficult, are the ones that impact health outcomes directly. So yeah, I think we'll have to wait a little bit more time, but I think those are the ones which will have the highest impact, as well as I said, right, will be are the most challenging, which is why we need to wait. So I think that's it, right? So thanks everyone for joining in. And if there's anything else that you want to share on the topics that we discussed, feel free to reach out to us. If there are other things that you're hearing, or there are different point of views that you have, we'd like to hear that as well. So that's it from all of us. And we'll see you again in the last quarter of this year for our third LinkedIn Live on care management. So till then, thanks everyone for joining, and take care.
Thanks everyone for joining.
Thanks everyone.